Thank you for waiting. After the Pharaoh's course has been fixed, I will start with my presentation. Just to thank the chairman for his kind presentation. I am also the current president of the Society of Endometriosis and Uterine Disorders, and I want to thank Dr. Gamal Serur and the whole organizing committee for inviting today me, and also for inviting the SEUT. I think this kind of collaboration with the two scientific societies, two strong scientific societies, is a very important way to build bridges among all of us. And my topic today will be about quality of life and adenomyosis, and try to find ways to improve the quality of life of those patients. You know that, as the previous speaker has pointed out, adenomyosis is a benign disease, a very prevalent disease, but very often is underdiagnosed, and a lot of times it's not even suspected. We forgot the existence of this disease. You know that endometriosis and adenomyosis share a lot of different features, being the most important probably the fact that in both cases we find ectopic endometrial tissue outside the uterine cavity. They have also, both diseases have also other similarities. They are estrogen-dependent diseases. The medical treatment is only symptomatic. The medical treatment is not always effective. I think it's been Dr. Chaperon who has quoted or maybe Dr. Silvia Vannuccini, who has quoted about the importance of the progesterone resistance in both diseases. You can use the same drugs in both diseases, and for sure we need a better classification. We are doing steps, for example, in adenomyosis, just to classify the different phenotypes of the disease, but we need to understand a little bit more about the disease before to have a complete design, complete draw of the disease. This ectopic endometrium in the two diseases share different molecular similarities between the two entities, and also there has been postulated that both endometriosis and adenomyosis share different pathogenetic mechanisms. However, there are also differences between the two diseases. Probably the most important is that the number of papers that you can find in PubMed about the two diseases. The investigation of adenomyosis is much less than the research that we are doing in endometriosis, and we need to improve it for sure. But I think it's very important to know that the percentage of the papers devoted to the quality of life in those diseases are very similar. In both cases, it's less than 5% of the published papers that are focusing on the quality of life of the patients. You must remember that both diseases are benign diseases, and the quality of life is probably the main goal for the patients, and we are forgotten about it. Quality of life is for sure is a subjective, is an individual construct from the individual perception of one's position in life in the context of the culture of the patients, her value systems, her goals, her expectations, her standards, her concerns. And in adenomyosis and endometriosis, in both cases, the symptoms, the infertility, pain, bleeding, are reducing the quality of life, and both diseases are impacting on all the aspects of a woman's life, like mental health, like family, the personal relationships, the employment and her career, the social life, and all the aspects, all the dimensions of the life are impacted by the diseases. And we had a lot of literature, even that the percentage is small, but the absolute number of papers investigating quality of life in endometriosis is huge. In fact, It is a very recent report in the English Parliament. It is all the parties parliament group. See, all the parties, so the political parties in England, they try to investigate how, not in England, in the United Kingdom, how the endometriosis impacts the life of the patients, and they make this very interesting report in 2020 with more than 1,000 response, with more than 1,000 answers from people living with endometriosis, and they clearly shown that the patients with endometriosis had the symptoms had a very negative impact on their well-being, on their life, and they almost all of them say that the endometriosis had affected their ability to live their life as they wanted, with a negative or very negative impact on her lives. But when you look for adenomyosis and quality of life, that remember that very similar diseases, you find very, very few papers. In fact, you have some papers explaining the frequency of symptoms in patients with adenomyosis, but when you look at in this is a very recent review about how to report the outcome in some treatments of adenomyosis, you can see that only quality of life were reported only in 9 studies. It's a very few amount, and we need to have more knowledge about the quality of life in patients with adenomyosis. Then in my apartment in Barcelona, some years ago, we decided, okay, we need to build the evidence. We need to show, because you know that the authorities and all the society needs to know, to have real data about how the adenomyosis impacts the quality of life of the patients. And we start an investigation that we are still going on, but we have already results, and we try to assess the quality of life and the sexual quality of life in patients with adenomyosis, the impact of adenomyosis in the psychological health of the patients, also to study how the adenomyosis impacts the marital life, the couple life, the relationships of the patients, and also the work productivity, and also to investigate if the combinations, if the very frequent combination of endometriosis and adenomyosis may have a greater impact on the quality of life of the patients. In this first paper that we published a couple of years ago, we tried to investigate the psychological health and the quality of life in patients with adenomyosis. We use 2 different questionnaires, the short form 56 questionnaires about health-related quality of life, and 2 questionnaires about anxiety and depression to assess the psychological life of our patients. As you can see here, the SF36 questionnaire, the short form 56 questionnaire about health-related quality of life is clearly worse in patients with adenomyosis. In all the different dimensions, in all the different summary, in the physical summary, in the mental summary of these questionnaires, the score, the punctuation of the patients with adenomyosis is lower than the patients without adenomyosis. It is exactly the same with when you look at the psychological health. The anxiety and depression are more frequent in patients with adenomyosis. And what is very, very interesting is that the main factor influencing the worst quality of life of the patients are symptoms. Patients with moderate or severe symptoms have a poorest quality of life than patients with mild or with mild symptoms or patients in the control group. In both components, the health-related quality of life and the anxiety and depression. And it has been confirmed by other authors. For example, this group from China, in a paper published last year, they also confirmed that the risk of anxiety and depression in women with adenomyosis is greater than in patients with other benign gynecological conditions. You can see here patients with Again, cases and controls have very different scores in those questionnaires. We are trying to assess also the sexual quality of life. Very often we forgot about this important aspect in the life of our patients, and we designed another study, another sub-study, using three different questionnaires about quality of life, the brief profile of female sexual function, the female sexual dysfunction symptoms, and the sexual quality of life female. Three different questionnaires to assess the sexual quality of life in those patients. Again, adenomyosis, it is shown that the sexual quality of life in our patients is worse than in patients without adenomyosis. And again, and also very important, when we did a linear regression method, a multivariate analysis, was the symptoms, the pain symptoms, dyspareunia, dyschezia, the factors that are related with the presence with a worse quality of life. And for sure, this kind of problems will impact in the couple relationship of the patients. You can see here how, using again the same questionnaire, and this other questionnaire, it is a questionnaire to assess the interaction between the two members of the couple. The patients with adenomyosis had a poorest couple relationships than the patients without adenomyosis. Just showing that effectively the impact of adenomyosis is in all the dimensions of the life of the patients. And not only in the personal life, it's also a matter of, it's a social problem, because you can see here we also try to assess the work productivity in patients with adenomyosis. And as you can see here, patients with adenomyosis compared with healthy patients, you can see here that the frequency of absenteeism, that is, I'm feeling bad, I'm not going to work, or presenteeism, I'm feeling bad but I'm going to work, even if I cannot work as I used to do, the rates are greater in patients with adenomyosis, and consequently the cost originated by the disease, not the sanitary cost, yes, I mean the activity impairment cost, the cost due to the activity impairment is much greater, it's almost more than double in patients with adenomyosis. And again, are the symptoms presented by the patients which related with the outcome here, that it is the absenteeism, presenteeism, and the cost derived from this kind of problems. Remember that symptoms are the responsible for the loss in quality of life. The last paper that I want to present you is this one in which we try to assess if the combination, if the concomitant presence of both adenomyosis and endometriosis may be even a worse scenario for the patients. And the answer is not. You can see here how in the health-related quality of life, both patients, deep endometriosis patients and deep endometriosis patients plus adenomyosis patients, had very, very bad, compared with the healthy patients, very bad scores, but there are no differences between only deep endometriosis and deep endometriosis plus adenomyosis in the health-related quality of life and the sexual quality of life. That's important. That's important. Symptoms are important. Symptoms are the point that we need to treat in order to improve our patients. It is clear to take this consequence, and again, is that true or not? Following this in this same paper that I just presented to you, you can see here how the quality of life of the patient after 1 year of hormonal treatment In both cases, patients with deep endometriosis and patients with deep endometriosis and adenomyosis, they are much better after the medical treatment. They improve their quality of life because they don't have symptoms. They have much less symptoms. In both cases, in health-related quality of life and sexual-related quality of life. It is another paper that we published very recently this year, and we try to analyze the clinical and the sonographic impact of the hormonal treatment on patients with endometriosis and with adenomyosis. And even in a very long-term follow-up, you can see here how it is the criteria for adenomyosis at the baseline was, for sure, all of them has more than 2 criteria. There were very severe cases of adenomyosis. You can see here how the clinical aspect, the sonographic appearance of the cases of adenomyosis are improving. The same occurs with the sonographic appearance of the endometriosis, the deep endometriosis, but the most important thing is that in both groups the symptoms improve after the treatment. And if the symptoms improve, we didn't assess the quality of life in this long-term follow-up study, but for sure are the symptoms which the main cause of the loss in quality of life. So if symptoms improve, you can see here how severe dysmenorrhea disappear when you have not menstruations. The severe non-menstrual pelvic pain also disappear in a lot of patients. So if you want to improve the quality of life of your patients, you must treat them as soon as possible. The same occurs with other studies has been also confirming this kind of findings. It is also a recent paper from Japan which was focused on bleeding. You can see here how the treatment of bleeding in patients with the MAIAs is a multimodal analysis of subsets for analyzing the quality of life in patients with bleeding. You can see here how after the treatment with in this case with Mirena, treating the bleeding also improve the quality of life of the patients. There are other papers here. Yeah, I'm finishing. There are other papers showing exactly the same. If you treat the patients, if you control the symptoms, if you make the symptoms go down or even disappear, the quality of life of the patients will improve for sure, and the general quality of life, the sexual quality of life. So don't forget, adenomyosis is a very frequent disease. You need to diagnose it. Dr. Rios has shown how to treat, how to diagnose. Professor Chaperon how to treat the infertility, and if you treat the symptoms, you will improve the quality of life of the patients, because the degree of impairment of the quality of life is related with the symptom severity, and this impairment of quality of life can affect all the dimensions of the woman's life, and you need to treat the adenomyosis to improve the quality of life of your patients. And please remember, as Professor Chaperon did before, this Congress, I want to invite you to our Congress next year in Geneva. If you are interested in endometriosis and adenomyosis and other uterine disorders, for sure this can be a very good opportunity to learn more, to discuss with your colleagues, and also to enjoy the friendship of the Seoud Society, of the Seoud, in a very amazing scenario, as will be the venue with the United Nations in Geneva. We have the compromise from the local government that the weather will be amazing during this month in Geneva, but if you like skiing, they also promise us that we will have still a lot of snow in the mountains, so you can enjoy not only the science but also the friendship and the tourism. Thank you.
Thank you very much. I think this